And if you ask people who actually are affected by the reform, they either changed coverage or got new coverage under the plan or remain uninsured, 50% of them say this reform has actually hurt them. Only 22% say it's actually helped them. So among people who are directly affected by the reform, most say it's hurt them. If you ask them if they have higher health costs, again, more than half say that the reform has increased their health costs. These are by and large near poor and middle class people. And basically what the reform is saying is we're going to charge people who can't afford it even more than they were paying before for their new coverage. Measures of underinsurance in our state, where did you need care but unable to afford it, you see that the trend is upward in the most recent years. As you go to the right here, very strong evidence beginning to emerge that underinsurance is increasing in our state. And Boston Globe poll showing that 14% of residents of our state say they had a medical debt they couldn't afford to pay within the last 12 months. 14% didn't fill a prescription because of cost, and 9% avoided care. So we have something that looks like coverage around the front, but when you begin to inspect it, there's a lot uncovered. Free care utilization at safety net institutions has fallen modestly, about 38% in our state, but funding for free care has been slashed precipitously. And as a result, at my safety net institution, we're closing half of the psychiatric beds, and we have the majority of the psychiatric beds in the Boston area at our facility. We're closing the only substance abuse program, inpatient substance abuse program in the Boston region, and cutting 6 community clinics because of the slash of state funding for safety net. If you look at the profits of hospitals around Boston, CHA is Cambridge Hospital. That was $1.6 million last year. We're $30 million in the hole this year. Mass General has made out like bandits. They made a $354 million profit, and the reform shipped enormous amounts of money their way.
Doctor, if I might, on that note of out-of-control profits, we've been joined by somebody who has taken point on a lot of these things, especially in her role as a co-chair in the Progressive Caucus. And I'd like your permission to allow a dear friend and someone I have great respect for to take the mic for just a moment, who's joining us from her very busy schedule. Congressman Wisley, please, I'd like to hear your thoughts.
I came to hear your thoughts, so thank you for letting me hear a little bit of what you're saying, and I'm sure I echo every remark you just made and every remark we're going to hear today. We're at a very important place in our nation, as we know. When I was elected in 1992, I was the first freshman in that new class in 93 to sign on to the single-payer health care system. I never ever regretted it. Every single thing that has happened since has proven to me how right we are. And I think what we need to make sure we're doing right now, I'm not going to go into detail on plan by plan. We have to make sure that we have a public healthcare system that is not dependent on insurance companies. So if we want to have a healthy country, we've got to address this. If we do it in part way, we'll be making a mistake because we will not get another bite of this apple for a long, long time. And the country is ready for it.
That's right.
In 1992, they weren't. In 93, by the time, 94, by the time the Louise and Harry ads were on the television, people were frightened. They were afraid they were going to give something up. Labor even thought they might be giving up some of their benefits for their people. Well, guess what? They are all giving them up now, and there's no safety net, and that is what we need. And I look forward to working, of course, with all of you and with John, and we have to get this done, and it has to be done right. So thank you very much.
Doctor, as we say on the floor, we yield back the battle one more time.
And the results of not actually getting the private insurance companies out of our system are enormous costs. So $1.1 billion last year, $1.3 billion this year, over and above what the health system was already costing, the most expensive in the world. And our Senate president had said if we don't constrain costs, the system we work so hard to create and implement will collapse. The director of the Connector, our insurance brokerage agency, has said we have double-digit increases annually. Health reform is not sustainable under that circumstance. Now, when we started this, our governor at that time said every uninsured citizen will soon have affordable health insurance and the cost of care will be reduced. And the New York Times lauded it and said the bill does what health experts say no other state has been able to do, provide a mechanism for all to obtain health insurance. Now, for those of us in Massachusetts, those were familiar words. Our governor back in 1988, when he was running for president, said, "I'm very proud of the fact Massachusetts will be the first state in the country to enact universal health insurance coverage." And we enacted a program very much like the current one. And the Times said Massachusetts last week ventured where no state has gone before. It guaranteed health insurance for every resident. Here's what's happened in our state with the Dukakis bill back in '88. We had a momentary downturn in our uninsurance rate after this reform was passed, but we wonder where we head, and we're already heading back up. In Oregon in 1992, they passed a similar bill, and the governor said, "Today our dreams of providing effective and affordable health care to all Oregonians has come true," and the Washington Post called it the most far-reaching health reform in the nation. Here's what happened in Oregon. We call these flat lines. In Tennessee, the governor called it the most radical health care plan in America. Tennessee will cover at least 95% of its citizens by the end of 1994. They had a one-year drop in Tennessee. In Vermont, the governor said this is an incredibly exciting moment that should make all Vermonters proud when his bill got passed. And the Times said Governor Howard Dean, the only governor who is a doctor, signed a law today that sets in motion a plan to give Vermont universal health care by 1995. And here's what happened in Vermont. This is getting dull, I fear, but in Minnesota is enacting a program that will be the most sweeping effort yet to provide health insurance to people who lack it. The first complete reform proposal in the country. Here's what happened in Minnesota. In Washington State, the Times said Washington has passed one of the most aggressive healthcare experiments in the nation, a program that would extend medical benefits to all 5.1 million residents of the state. And there's what happened in Washington. In Maine, the governor said it's bold and comprehensive, and it's now the law of the state. And the Post said Maine has just become the first state in the union, how quickly they forget, to approve a plan to provide universal access to affordable health insurance. Well, there's what happened in Maine. If you ask the American people what would they want in healthcare, do you think that if we had a socialized medicine system in this country, that the healthcare system would be better or worse? So the worst possible description in terms of PR. And you see that 81% of Americans say they're ready for socialized medicine, even if you call it that. Even 19% of Republicans favor socialized medicine. Now, we're not talking socialized medicine with single payer. We're actually talking about social insurance. But even if you put it in the worst possible light, the American people want it.